When it comes to anxiety disorders, there is no one type. Each form of anxiety has its own set of symptoms and treatments. It is important to remember that, while some symptoms will overlap, no two anxiety disorders are alike. We want to bring attention to the 5 major anxiety disorders and what they mean for the sufferers. We hope to bring awareness to the growing number of anxiety sufferers and their needs. Here is 5 anxiety disorders as well as their symptoms and treatments. The 5 major anxiety disorders.
1. Obsessive-compulsive disorder or OCD. Obsessive-compulsive disorder technically has 2 components, obsessions and the compulsions. What we mean by obsessions are anything from a strong fear of germs to the placement of furniture around the home. What we mean by compulsions are what the sufferer does to get rid of those obsessive thoughts. Someone who has obsessions about germs may ritually wash their hands or carry hand cleanser everywhere they go. Someone who has obsessive thoughts about the placement of objects might arrange and rearrange their belongings until they feel comfortable and safe. The sufferer gets disrupted by these obsessions and compulsions in their daily life. With behavioral therapy, the sufferer response to obsessions can be reprogrammed. The medication and therapy are the main treatment for the obsessive-compulsive disorder.
2. Generalized anxiety disorder or GED. Generalized anxiety disorder or GED is a bit different from other anxiety disorders on this list. Those who suffer from GED aren't always able to give a reason for their symptoms. In fact, one of the symptoms is a general feel of restlessness. They may also experience worry as one of the symptoms. Another symptom is a disturbance in sleep pattern. Meditation therapy is used with GED as well as relaxation techniques and mindfulness.
Three. Social anxiety disorder. Those with social anxiety disorder experience panic attacks related to social situations. This can cause a fear of public speaking or stage fright. This can also stop them going into public. Social anxiety can also have symptoms of strong self-consciousness and a general fear of being around others. Here is someone who we think doesn't have any social anxiety. Social anxiety is mainly treated with medication therapy. Each sufferer presents their own needs that must be taken into account. Each therapy is not going to work the same for each individual.
Four. Panic disorder. For the other anxiety disorders, panic attacks are just another symptom. When it comes to panic disorder, those attacks are the main symptom. Panic disorder is characterized by panic attacks. The sufferer may experience heart palpitations, a rising pulse, and intense fear, the feeling that they are hopelessly out of control. People who suffer from panic disorder can get help from medications and therapy. These treatments support each other and maximize the usefulness of each.
5. Post-traumatic stress disorder. PTSD is the result of a very traumatic event or series of events. For the most part, you have probably heard it when someone speaks about veterans or police officers. Post-traumatic stress disorder or PTSD can be diagnosed in anyone. Sufferers with flashbacks and night terrors mostly suffer from panic attacks as well as phobias related with people, places, or even sounds. Therapies such as exposure, cognitive processing therapy, and brief eclectic psychotherapy can be used. Also, medication used in the treatment. This is a situation where the use of medication and therapy together can help give a better outcome. than just one alone.
This is not a complete list of the different anxiety disorders out there. There are many kinds of anxiety, this just happened to be most talked about. Regardless of which anxiety disorder the diagnosis is for, it is important to remember that the sufferer needs help and acceptance. You don't have to understand anxiety to be able to offer an ear to talk to.
Remind the sufferer that they are alright, that what they are feeling are just symptoms of their anxiety and that it will pass if given the time. Aside from that, just make sure that they know you are there and with them, and wait it out.